At this time, I would like to turn today's program over to Canada Health Infoway. The floor is yours.
Hello and welcome everyone to today's webinar, Direct Patient Access to Lab Results, where we'll discuss patient expectations, experience value, and physician perspectives. Just a few housekeeping notes before we get started. Today's session is being recorded, and the recording and presentation deck will be made available to participants and also on the Infoway website once available. And we'll follow up with registered participants after the session to let them know when that will be. And to support the recording of the session, as was just indicated, the lines are muted. Please keep track of your questions. If you're attending in a room with a group, please write your questions down and hand them to your room coordinator, or use the Q&A function as indicated by typing into the Q&A panel and send to all panelists. As we reach the question and answer part of the session, we will direct questions to the presenter or all presenters by repeating questions for everyone to hear. Hello and welcome everyone. My name is Chad Lever, Benefits Realization Leader at Canada Health Infoway, and in today's presentation I'll be providing an overview of Canadians' electronic access to their health information and emerging points from the evidence, and some survey data on Canadians' expectations and clinical governance perspectives on direct patient access to lab results. I'll be sharing key findings from the 2015 Direct Patient Access to Labs report, and my colleague, Karen Taylor-Hughes, at Canada Health Infoway, who is our National Change Management Lead. I'm just moving the slides ahead for you guys. We'll be talking about the qualitative physician interview findings from that report and share change implications for clinical practices. Our guest today is Dr. Mark Clark, a practicing BC family physician who will share his experience with patients accessing their lab results online through the BC solution. Thank you very much, Dr. Clark, for joining us today. And without further ado, when we look Infoway's annual survey of Canadians has been asking since 2010 what proportion of Canadians can currently access their own medical records electronically, for example, looking up their lab test results. And as you can see from this slide, only a small percentage of Canadians report that they have access to their own medical records, at only 6% in 2014. However, when we look at the results by region on this next slide, we see that Canadians' electronic access to their medical record is largely driven by British Columbians, where 27% of BC residents report that they can access their own medical record electronically, largely driven by a broad provincial solution where patients can access lab results through the Accelerus My eHealth portal, with the rest of Canada coming in at about 3% or less. Now, a number of projects across Canada currently are gaining momentum with the recent launch of My Results in Ontario and a number of patient portals proposed to launch in the next few years in Alberta, Saskatchewan, Manitoba, and Nova Scotia. We do anticipate accelerated growth of patients reporting electronic access to their medical records, given current Infoway jurisdictional and organizational investments. In terms of the evidence, there are three main emerging themes that are pointing value to patients as they access their own medical records. Studies have focused on the impact of health services utilization and physician workload, with mixed results where studies have shown an increase or no change in patient phone contact with the office, an increase in physician workload to support electronic messaging, and studies suggesting that face-to-face or in-person visits stay the same or decrease. Research has also highlighted improvements in the quality of patient-physician interactions, with patients reporting they are better informed about their own health, such as being prepared for visits with questions and understanding the impact of treatments and preventative care on clinical outcomes. A number of studies, including a recent systematic review, highlighted improved patient self-efficacy, with improved uptake of preventative care, increased rates of medication adjustment by patients with diabetes, and in cases where patients can view their own medication profile, detection of medical errors in their record. At this point, I think it's important to illustrate the process by which lab results are managed in primary care. This process map was detailed in a 2012 University of Toronto study showing that the number of steps at the top of the slide, from ordering the lab test to sorting the results when they arrive in the clinic, either by EMR integrated receipt or by scanned or paper-based processes, require a number of steps by physicians, seen here in the white, and clinic or clinic staff or administration in the yellow. So where is the patient in this process? Typically, when an abnormal result is reviewed by a clinician, admin staff contact the patient to book a follow-up appointment. In some cases, patients may receive the results over the phone, but most likely will first learn their result at their in-person visit, where staff or the clinician will call up the results during the visit to discuss with the patient. With normal test results, many patients may call the clinics and ask for their results over the phone, or they'll receive it at their next follow-up visit. But when the patients have direct access to their labs, as they do in BC or the Ontario solutions that are now available, they receive the results at the same day that the results are provided to the ordering physician. They become an engaged participant in the circle of care, and they have the ability to learn the results much sooner and initiate follow-up with their physician or regular place of care. Direct patient access does, however, introduce some important governance questions about whether to delay the release of online lab results to patients to support medical review prior to the release with patients. Now, patients access My eHealth in BC or My Results in Ontario do not release sensitive test results. They're contingent upon standard tests. Sensitive test results are not released. And among a number of Infoway consumer health projects in Ontario, most sponsor organizations do release normal results immediately. However, they all delay results of the release of abnormal test results by some period of time. In 2015, we asked Canadians what their expectations were with regard to accessing their online test results. And this slide shows that 60% of Canadians would look at their medical test results right away if they were available online. And overall, and this is the green section of the graph, 72% of Canadians say that they are motivated to access their lab results online, with a very small proportion, only 15%, saying they wouldn't access their test results online. In terms of a couple of specific project examples, the Children's Hospital of Eastern Ontario does release normal results the next day and delays release by 10 business days for abnormal medical imaging and other reports, and doesn't release results Friday through Sunday. In their evaluation survey with patients and clinicians, patients and physicians indeed support the delay of online results for medical review. And survey results indicate, however, a bit of a mismatch with patient and physician perspectives, where the majority of patients expect results to be available within 3 days, where clinicians suggest that the delay could be either up to 5 days or only available online after the patient has been seen in person. In a Sunnybrook surveyed users of MyChart, their online patient portal solution, in 2012, with over 2,000 respondents to their survey. The survey indicated that an overwhelming majority of MyChart patients, at 89%, value MyChart and its features, and access to text results were patients' highest priority at 81%. And although a large proportion of patients wanted immediate access, the majority were in fact quite comfortable with a moderate delay of up to 5 days. One of the clinician comments from the survey notes that they learned from a patient how once they were shifted from immediate and timely access to blood test results through MyChart to a 14-day delay, resulting from a change in registration to another Sunnybrook service, negatively impacted the patient's ability to access the necessary care to immediately deal with a care concern at hand. As patient access to their health information grows in Canada, it will be very important for organizations to align patient expectations and clinical governance requirements. Now I'd like to share some key results from the 2015 SRDC report and peer-reviewed manuscript on direct patient access to labs in BC. The study focused on how direct lab access affects patients' experience, their utilization of healthcare services, through a patient survey with BC residents and qualitative interviews with 20 physician participants. The physician interviews explored the impact of patient access to labs on workload and relationship with patients. I invite you all to consult the report or the manuscript where the study methods are detailed in full, but briefly, the patient survey was conducted online and completed by BC residents who had a lab test in the last year. A total of 2,047 residents who first learned the results online are compared to a sample of BC residents, 1,245, who received their most recent test result at an in-person visit or were contacted by the clinic. This table provides our results on access and utilization metrics. The table compares patients who accessed their most recent test result online to those who first learned the result at an in-person visit. Patients who learned their results online were more likely to have received their most recent result in a few days and to know the result of their most recent test. And they were less likely to report that they contacted their doctor's office while waiting for the results and to have had any in-person visit in the process of receiving or discussing their most recent test results. These are statistically significant findings and suggest that direct patient access does not necessarily lead to an increased or inappropriate service use or burdening the primary care clinic with excessive calls and contact. The survey also asked patients about the value of accessing their test results online, and 95% report that accessing the results made them feel more confident about taking care of their own health. 94% said it improves the knowledge of their health, and 93% report that they have more informed discussions with their doctor. Interestingly, when we asked BC patients whether their physician or regular place of care encourages them to access the results online, only 56% of those who learned the results online say their physician encourages them to do so, and only 6% of the comparison sample, those who got their results in person, have their physician recommend that they access their results online. One of the study questions was to understand the impact of online access to test results on patient-reported anxiety. As seen in this figure, only a small proportion of patients in both cohorts reported some anxiety after receiving test results. That's on the left side of the slide. While those who learned their result online were more likely to report some anxiety while waiting for their test, the graph on the right, we found no significant differences in patient-reported anxiety after receiving their lab test results. The analysis is adjusted for effect of having a test result out of the normal range. This next table shows the results of our analysis with a subgroup of participants in both cohorts who learned the results online to those who learned in person, and a subgroup of patients reporting one or more chronic health conditions. Here, differences between the two cohorts emerged, such that patients with a chronic condition who learned their result online reported being significantly less likely to be anxious after learning the results, at both ends of the scale. So folks who learned the results online were less likely to were less likely to be anxious if they had a chronic condition and they got their results online. And we were also interested in patient comprehension of results and reported levels of anxiety. And to illustrate here, we have a patient view of their test results that would be seen as a screenshot here available through the BC solution. So here's what patients actually see, and it's the same as what a physician sees. The results are not adjusted or changed in any way in terms of the patient view or the physician view. And what we learned was that the patient survey results suggest that 76% of those who access their results online are confident they understand the results. Those who learned the results online were more likely to report somewhat lower understanding of their results compared to the comparison group of those who got their results in person at 24 versus 15%. And in this final table, we explore patients who are not clear on the need for follow-up and reported anxiety after learning their results. Patients who report that they were not clear on whether they needed to follow up were more likely to report some anxiety after learning their most recent test result online. Conversely, those who were clear about following up were more likely to report no anxiety. So in summary, the study findings suggest that patient experience overall can be improved by the availability of direct online access to test results, but with very important caveats and implications for physicians in clinical practice. With that, I will turn it over to Karen Taylor-Hughes to share some of the qualitative results from the study. Karen?
Thanks, Ed. Hi, thank you. Very interesting stuff, and this was a very important study to me. I was involved in sort of helping in the beginning. At the time, I lived in BC and experienced access to patient results, and I wanted to know what physicians thought about that. So I got a chance to talk a little bit about the physician qualitative responses to the survey and the study interviews that happened during this report. As you mentioned, 20 BC physicians were interviewed by telephone. Interestingly, 18 out of 20 of them said they were aware that a portion of their patients currently actually access their lab results online, and they estimated anywhere from 5 to 50% of their patients actually had access. Few of the physicians had actually accessed an online test result for themselves. When asked to rate the experience with patients having direct access to lab results on a scale of 1 being negative to 5 being positive, a quarter of the physicians, 26%, rated it a 3, and almost two-thirds, 63%, rated it a 4 or a 5. So overall, they felt that it had no impact or a positive impact, and no one said it was negative. Looking at the areas that we focused on in the study, the first one is the impact on patients' access to online services. The impact of the majority of physicians interviewed reported a relatively balanced perception of direct access to lab results in terms of overall patient experience, citing both benefits and challenges. Many, however, noted that the benefits potentially outweigh the negatives. As one physician remarked, time and time again it seemed that patients who are proactive about their health manage their health better, in cooperation, of course, with their physician. And it makes them more involved with the added benefit of online results. I think it improves patient care and patient autonomy and the sense of responsibility for their own health. Specifically, physicians saw the greatest benefits to patients who suffer from chronic disease illnesses in helping them monitor the status of their condition and, in turn, managing their own health. They cited several chronic health conditions as suitable for monitoring through online lab access, including heart disease, inflammatory conditions such as rheumatoid arthritis, diabetes, cholesterol-related illnesses, thyroid disorder, anemia, COPD, and kidney disease. Monitoring patients' use of blood thinners was also noted as being helpful. A few physicians noted that their more engaged patients had embraced the service. It's an excellent program. Patients are very receptive to it, one physician said. So again, looking at the patient experience, the positives, increased level of engagement, also empowerment, that leads to helping them monitor their own conditions. They become more proactive in their health care, and potentially to help motivate change in health behaviors and timeliness and convenience. The challenge is the potential for misinterpretation of lab results. The greatest challenge identified that, and that was because patients were described as often lacking sufficient understanding and knowledge to interpret results. Physicians noted that a lab result can sometimes present only part of a larger picture. As such, physicians highlighted the critical role they play in the interpretation of results, particularly if they are abnormal, and the continued importance of the patient-doctor relationship in managing levels of anxiety and the flow of information. As one physician said, we need a personal window with the patient. As I move to the next slide, we're going to be talking about the perceived impact on the impact of patients' use of healthcare services. There was a clear lack of consensus among physicians about whether or not direct lab access increased patients' overall use of healthcare services from their primary care provider. On the positive side, patients can see results online, and that is useful for me, one physician stated, as it cuts down the number of phone calls to my office. Another qualitative response, it allows me to improve my quality of care that I deliver in a more efficient manner because I don't have to keep calling them back, and they don't have to keep coming back. They can just check on the internet. So a reduced number of unnecessary visits and follow-up calls in their clinics to inquire about the results was a huge positive. On the challenge side, a number of physicians noted that patients' confusion or need for more information had led to an increase in the number of patient visits and calls, as well as some time spent with patients in person. As one physician remarked, accessing results online generates more phone calls that I will have to return. A lack of medical knowledge sometimes causes patients to call in cases where they see results which worry them. This generates more paperwork for me due to having to get back to patients about inconsequential results they are concerned about. Likewise, a few physicians said they had found increased patient visits and calls to be burdensome on their practice. It impinges on our real time to treat the patient. So definitely some of the challenges are the confusion, the need for support and interpretation of the results, as well as the time spent in person when the patients arrive to the office explaining what they've seen in their lab results. But interestingly, some of the physicians who felt that direct lab access had increased patients' use of their services also argued that benefits for patients outweigh the disadvantages to physicians. For example, they indicated that direct lab access could save physicians time overall and encourage patient responsibility. The vast majority of physicians viewed direct lab access as timely and providing an increased level of knowledge, leading to patients being better informed and having a greater sense of empowerment over their own health care. One physician said it well, "I like people being knowledgeable. It makes my job easier." We go to the next perceived impact, which is on the patient-physician relationship. Most physicians did not think that the direct lab access had affected the overall quality of their relationships with patients or the way in which they communicated to inform their patients. So the positives, they actually saw that it was an opportunity to provide patient education through pre-counseling on what to expect from lab results in order to manage potential levels of anxiety among patients. And again, some of them stated no major changes to date in the administrative procedures at the clinics at this time. A few physicians did say they were currently not recommending online access, in part due to their own lack of familiarity with the service and to a level of cautiousness, depending on the individual patient readiness and their specific situation. Each physician group spoke about that percentage of patients that worry, and no matter what their results are, they will worry, and they felt that having access to online results might make them worry more. As we've seen with the results that Chad just shared with us, that's not always correct or accurate. If you go to our next slide now, we're going to look at a practice perception. Oh, I'm sorry, one more slide here. So looking at lessons learned, BC has direct access, so patients and physicians have access to lab results at the very same time. So asking these physicians what they felt would enhance the service, they had a few suggestions. Increase the education for both patients, physicians, and staff. Have more information on terminology and how to interpret the results. Provide marketing and communication materials like brochures, et cetera, posters to put in both physician offices as well as medical lab offices. Create an integrated communications platform for physicians, and lab folks. Physicians could indicate when they have reviewed results and they say they were okay. Physicians could be alerted when patients have signed up to access the lab results online. And patients could alert the physicians if they have concerns after viewing their results. And they also suggested, some of them, that they stagger or delay the delivery of results. Looking at the issue of direct access to lab results, as we see, there are multiple projects going on across the country. BC is well ahead, as is Ontario, and it's something that's going to be happening, and patients will be getting access to their results. Depending on the governance, will determine how and when, but as a practice, there are things to consider when you're looking at getting ready for such an event. Our final slide speaks to the steps that you can do to ensure that both as a physician and a practice that you're ready as well as your patients. Discuss and experience the way patients will access their online lab results with your team. As I mentioned, quite a few doctors of the 20 interviewed for the BC study had not gone online to look at their own lab results. So it's important that the practice members, the physicians, and the staff go in and have access to that to know what that experience is like and what barriers or challenges some of their patients might have, and to understand what they will be viewing. Select a process that aligns with patient expectations and works best for your practice or organization. Depending on where you are in the governance, you may have some choices or you may not, but if you do, look at how you will potentially support that and how you as a practice will be ready. Have materials on hand to share with your patients. They will have access to lab results, so it's better to educate them before that way they don't go to the lab or get confused later. Next slide, please. Identify patients you feel would benefit from direct access to lab results. I mentioned that lots of physicians felt people with chronic diseases would be very good to be able to learn how to monitor some of their own lab results. So you can identify some of those, and then you can actually encourage them to sign up, and you can educate your patient. Discuss the process of accessing their results. If your team has been through it, then you know exactly what to do. You can walk them through that. Show the results they will have access to. You can print up a copy of a result that you have a lab panel and share it with them, that's theirs, and walk through and talk about it and educate them on the results. The ranges, high, low, abnormals, let them know what to look for and let them know when they should call for an appointment if they have concerns. I think if you preface those things and have your team ready, then I think it will make the transition for your patients and for your practice a lot easier. To add to the responses of the 20 physicians interviewed for the BC study, we are fortunate to have with us today Dr. Mark Clark from BC. Dr. Clark, welcome. Can you share with us your experiences with patients having direct access to lab results?
Thanks, Karen. You basically stole most of my thunder.
Sorry about that.
I say thank you very much. You've stolen most of my thunder. That was a great review of the questionnaires of the 20 doctors in BC. You hear me fine?
We hear you fantastic. Thank you.
All right. So I guess what I prepared was a little perspective of my history of sharing information with patients over the years. And I'd start by saying that you know, I got three phases where the paper chart world, and then there's the EMR world, and then there's now the e-health world. Back in the paper days, I would often photocopy things on my patients that I had in the paper chart, anything that was relevant or might help the patient or myself in terms of carrying them. In the EMR world, with the introduction of the computer screen and the printer in each of the offices, this became much handier, and undoubtedly I share more information just because I have a printer nearby. And of course, with the introduction of the EMR, patient information gave me opportunities to use graphs and whatnot, and that I found particularly helpful. It would appear that the patients are rather like myself. They quite enjoy the graphs and they're visually oriented. Now in the e-health era, the patients, of course, now have the opportunity to review the results prior to the appointment, and thus they will arrive either with paper in hand or at least have seen the results. The benefits from their having reviewed the results that are, and you've described this, that accelerates the consultative process, or the process of reviewing the results, as the patient now already knows the numbers. In all likelihood, I will need to review those numbers with the patient and make sense of them in terms of what that means for the patient and in the condition that they might have. But it moves along the conversation quicker, and we progress quicker in teasing out the implications, I suppose, of the results and whether we need to make any response or changes. Now, I also kind of broke down the kind of results that I would share with a patient, and I put those into 3 different categories as well. Under test results, now again, this is my office, and this isn't just e-health related stuff, so this is other than lab things. I might obviously share x-rays and ultrasounds, CT scans, MRIs, anything that would help the conversation along and help the patient's understanding of what we're dealing with. And that's number 1, the test results. Number 2 might be consults. And we were discussing earlier whether this kind of thing would end up on eHealth eventually. But if appropriate and helpful and perhaps neutral, I would say, I might give the patient a copy of the consult. And the consultation is often very self-explanatory to the patient, so that would be very helpful. And the final thing that I share with the patient is summary sheets. My medical office summary sheet can be helpful, particularly people who travel abroad. They can use that as a baseline medical history if they ever get into trouble. And now that we're doing so much chronic disease management, it's a nice kind of way of looking at their whole medical picture. This is the summary sheet now I'm speaking about, wherein everything all their medical issues are basically on one page, and I use that as an education and as a guide as to their big picture, and in particular with chronic diseases, it's a list of their comorbidities and whatnot. Unfortunately, my current EMR isn't as good as the old paper world, and I can't get that on one page yet, but that's something that hopefully will get better over time. As to the benefits of sharing, results and whatnot with the patients, again, you stole my thunder. I can think of 2 or 3 things. Hopefully, the patient will own their condition more, and they're part of the teamwork. Perhaps patient satisfaction is higher, and we've given them some degree of empowerment. And as I stated before, it brings the level of discussion and understanding of their medical conditions to a higher level. And again, this consistently, in my practice, seems to be related to the chronic disease management issues. But it does have a place for acute illness issues, and I can, again, either radiologically or otherwise share information with the patient. I get a few examples here of the acute medical condition. I can think of a CT scan showing a herniated disc, an ultrasound showing an ovary, and of course some people want to have access to this information in a hard copy fashion, either that or on their computer, because they may want to refer back to this later on, and it may come in handy. In terms of the chronic medical conditions, and that's my most clear-cut use for all of this. There's many situations, and you allotted to it earlier: diabetes, chronic renal disease, some hematological conditions like CLL, and graphing the A1Cs or an ACR or a renal function or a hemoglobin is particularly easy to see, and the patient and I can see a trend quite clearly. There's also a number of non-chronic kind of diseases that we might want to graph out, the TSH and hypothyroid, the cholesterols, chronic iron deficiency, graphing out a ferritin level. Under concerns or whatever in terms of what could go wrong with accessing eHealth, fortunately I have had no negative experience at all. I cannot recall a particular situation where anybody has got upset or whatever, but I certainly can imagine that at some point in time that might happen, and I'm glad to hear the delay that's available for getting the test results. I didn't know that. So that presumably, unless I was on holidays, would be an opportunity to put that fire out by attending to the patient before they got any significant bad news. In terms of who I recommend go on eHealth, because most of my patients I think I've recommended, it's almost always a chronic disease management patient to follow their chronic numbers usually. The acute situations I often don't bother unless they're already on eHealth. And there are some people who just can't be bothered, or either because they're not inspired to do it, or as I say, sometimes people, especially if it's an acute situation and they've had lab results done or whatnot, they just don't want to complicate their life anymore. They're busy enough and life's busy enough that they don't want another file for their CBC or whatever. I think that might be all I had to say. You had some great points, Karen, and basically most of what I've had to say is to kind of reiterate what you said and support. I'll stop there.
Great. Well, great. Thank you very much, Dr. Clark. It's Chad, and I'd like to kind of transition to the question and discussion part and invite folks to enter questions on the Q&A function of the webinar tool. I guess I did have actually a couple of questions pop up already, and one of them is related to the graphing of patient test results. So can you let us know, like visually, can the graph include an evolution of lab results based on granular data over time?
Yeah, like the simplest one may be like an A1C for diabetes 2, and I've had an EMR for 4 years, so I can go back 4 years, and it's remarkably revealing sometimes trends, and sometimes I'll simply print the graph off and give it to the patient and say, what do we do now? Does that answer your question?
Yep, that's fantastic. And I'm wondering, do you have maybe a patient example of how, the conversation has changed and how the patient has kind of become engaged with their results and perhaps potentially, changed behaviors or responded to treatment?
You may be a little disappointed. I don't have a case of an epiphany where someone said, geez, doc, that's amazing, and my whole life's going to change, and I'm going to now do everything I'm supposed to do. But on the other hand, I would say I have a multitude of low-level changes that people have made. So it's kind of incremental rather than a sudden life change.
Okay. Thank you very much. Are there other questions here? Sorry, I'm just going to scroll down here. Let's see. Okay, I'm just going to read a question from one of our participants. I may have missed the information at the beginning, but how are patients provided access to the results? Can physicians select patients that they feel would benefit from accessing their results and block patients that may be detrimental to? So in my understanding of the Ontario and BC instance where patients can access their results, the process by which they are able to access the results really starts when they go for their tests. So identification and identity verification happens when the person is at the lab and in front of an individual, and they receive the information and login criteria for them to access results. There's no way for physicians to select what patients would benefit and therefore specify who may or may not be able to access the results in those provincial solutions. Certainly in other organizations like Ontario Projects at Sunnybrook or Children's Hospital Eastern Ontario and others, different units are pilot testing the patient portal and therefore are offering the solution or the opportunity for patients to see their results through an enrollment process, and it would be through there where they, are inviting patients to participate. And I think really through physician encouragement, that's where physicians would be supporting patients through their use of that online tool. But in the instance of BC and Ontario, no, patients have access to the results that are theirs. And another question I have is there any framework in terms of patient right to access electronic medical records? And I think I'm not actually the individual who could answer that. I just do know that patients do have the right to their health records, whether they be electronic or paper. Following, another question I have is there a change for patients? Is there a charge for patients for this service, and who supports the patient if having technical difficulty? In the Ontario and BC examples of this that were reported in our study, no, there is no charge for patients to access their online lab results, and I do believe that there is technical support available via the website where patients are accessing their results to help them technically log on to the portal and navigate the system. But in my understanding, there is no supportive material there that will detail how to read every single test result that might appear on the system. And another question from a participant, does receiving results electronically cut down the number of face-to-face visits required between patients and docs? And perhaps, Dr. Clark, I'll ask you if you've noticed any difference in your practice in terms of those who may be accessing results online and reducing the number of face-to-face visits for patients just to pop in to get the result.
It's unclear to me. I'm not quite sure. Again, most of my patients would be, if they're coming in for a review of their chronic condition, be it diabetes or kidney disease or whatever, they often go online. We have prearranged their blood work. They go online, they've got their numbers, they either come in with the numbers, they got it in their head, and we review them. So that's a predetermined visit that was going to happen anyway, and they're just doing their homework prior to it. I suppose there's a few situations where I'll say to somebody, so you're online, so you're on the eHealth. I'll say, well, double check. I have one fellow, for instance, who's got a problem with his sodium. I know when his sodium result comes in to my EMR that he's seen it, and I also know that if it's off, I'll be getting a call from him. So that probably does save a whole lot of calls. Otherwise, he'd be calling in and discussing that kind of thing with my medical office assistant.
And from the literature in this most recent systematic review, the results showed that there was a decrease in face-to-face visits among those studies that were robust enough to make it into the systematic review. And our research with the BC patient survey does indicate that patients are less likely to have utilization points, meaning have they called the office, have they dropped in for a visit if they've got the result online. So current evidence does seem to suggest that.
Well, one of the comments I might throw too, and I really differentiate between an acute medical condition versus a chronic one when it comes to e-health data. Often we send someone out the door and they've got their tests to be done, and it gets done, and we'll often, we might say to them in the old days, no news is good news. But by going online and double checking their test results, they're just confirming why they didn't hear from us, i.e. that their test results were normal.
Okay. Another question for Dr. Clark. If you know the patient has online access, do you rely on that? Example, that they've seen that they've seen their INR, or do you follow up to make sure that they have acted on the result?
It's the early days of all this online patient information, so for sure I would follow up with everything. I make no assumptions that they have seen the results, and quite honestly, and this is one of the things that came up with some of the other talk was, I don't know which one of my, I may know which one of my patients are on, but I don't know all of them. So yeah, I would definitely have them follow up, and or in the case of an INR, we will phone them and direct them.
Terrific, thanks. And another question I have is the ordering of electronic lab is the ordering of labs electronic, or do patients still carry a piece of paper? And if electronic, do you find an increase in follow-through? I think in most instances, physicians print the electronic lab rec across Canada, and patients still carry a piece of paper. I'm not aware of any instances where the ordering is directly electronic in primary care. Would you say the same, Dr. Clark?
I agree, yeah. Certainly is with me.
Yeah. And I have a question here. What tests are considered sensitive, and who or how was that decided? And I think, from my understanding, that there's a number of clinical governance committees at organizations that are determining that. I think provincially, I know prior to the launch of the Ontario solution, there was lots of engagement with governance and leadership specialists on deciding what that is, what those tests would be. So I think it's not a carte blanche. There's a number of individuals and organizational leadership involved that is deciding that certain tests require a bit of delay, particularly around cancer or HIV or other sensitive conditions.
That was news to me. I didn't know that there was a category of sensitive tests to be kind of held back or whatever. It's good news to me.
Mm-hmm. Yeah, in even BC, for sure, there are a number of tests that are not provided through the online solution, and that patients do have to follow up with their clinician to get those results. And the same is true for Ontario. I think we're edging to the end of our questions, unless any more come through. So I have a question here. Dr. Clark mentioned that he can see within his EMR the graph or evolution of historic information of the labs. Does the patient see his lab results from the EMR from another system? And the patient actually sees their results through the online patient portal that is not the physician's EMR in their office. I think what Dr. Clark was mentioning is when he's in visit with the patient that he's looking at the results within the EMR for that part of the discussion. But the patient can see that tracking online through the web portal available to them. So they are separate solutions.
Yeah, Chad, I'm a little apologetic. I haven't gone online to register for eHealth because my family physician sends all the results that I ever had by EMR because he copies me. Are they able to graph on the eHealth site?
Yes, I do believe online tracking of historical results is available.
Yeah.
Yeah. So I think that's about it. I haven't seen more questions come through. I just wanted to thank participants for joining the call, and that we will be providing the slides as well as a recording of the presentation following the session in the next week or so. So thank you very much for everyone for taking the time this afternoon to join us today. Please contact myself or Karen if you have specific questions about today's presentation, and we look forward to having you join other webinars from Infoway in the future. And thank you very much, Dr. Clark, for taking the time today out of your busy schedule to share your experience.
Thank you, Chad. Very welcome.
Thank you.
Thank you again for joining us today. This concludes today's web conference. You may now disconnect. All presenters, please hold.